Dr. Simon Chiu, running the video presentation on our randomized control study, along with my colleague, Dr. Merwan Husni and Dr. Ed Liu. This will be the presentation by the research trainee, Autumn Tekanani. The title is We Want to Explore the Panax Ginseng dual targeting inflammasome and GLP signal pathway in type 2 diabetes prevention and cardiovascular risk reduction. We want to present the multi-site findings. As the study was funded by the Stanley Medical Research Institute, we have not received and will not receive any financial support for participating in the program or the session. The study was fully approved by IRB of the different sites as specified in the poster. The major findings of our multi-site randomized control trial is twofold. One is to examine whether the Ginseng 115 can reduce the diabetes risk and cardiovascular risk factor, along with the improvement in the persistent negative symptoms in the cohort of treatment-resistant schizophrenia. We choose that the TRD cohort for a number of reasons. The cohort has been shown by other investigators to have a higher metabolic risk, obesity, and diabetes type 2, and cardiovascular disease with reduction in life expectancy across the different studies on a global level. Our hypothesis is that ginsenoside isolated from the Panax ginseng can reduce both the negative symptoms, cognition, and depression in parallel with its metabolic cardiovascular effect in improving the cardiovascular risk and diabetes risk period. We analyzed the cohort findings and summarize the following. We demonstrate for the first time Ginseng 115 reduce the diabetes risk, which correlate with the insulin resistance as estimated by the hormone model, which in turn correlate with the obesity risk score period. Furthermore, we demonstrate that the diabetes risk correlate with the depressive symptom score as measured by the HAM-D period. We are able to demonstrate a dose-dependent effect of the Ginseng 115 on diabetes risk score. 200 milligrams was effective, whereas 100 milligrams was ineffective, period. Furthermore, we use a Framingham cardiovascular risk score to demonstrate the cardioprotective effect of the Ginseng 115 period. We also show that the cognitive measures in IRB correlate with the insulin resistance as well as the lipid profile, period. Our study are consistent with the previous findings that global cognitive deficits in schizophrenia are associated with metabolic syndrome, diabetes, and hypertension, period. In summary, we demonstrate for the first time ginseng-115 in dual targeting NLRP3 inflammasome and GLP-1 signaling pathway improve both the diabetes and CVD risk in concert with the negative symptoms and depressive symptoms, period. We do not report any adverse events, period. Our studies had implications to organize an integrated behavior health, metabolic, cardiovascular risk prevention and treatment platform, fusing lifestyle change in terms of exercise and diet regimen with a new class of drug lead platform. We integrate the neurotransmitter with the immunity inflammasome pathway and find in our studies ginseng-115, elemental sulfur, liposomal curcumin all share the same final pathway. Thank you.